months having problems, quarreling, every time quarreling he comes.
That was a build-up to what would later lead to this 24-year-old mother of two ending up in hospital.
Now one day, I left work at around 6, so I told the maid that in the flask there is no water, please boil some water for the flask.
Little did she know that this directive was one she would later live to regret.
And my husband came back home. He was so drunk that it was a sugar cane that was holding him. So he entered the bedroom and started vomiting everywhere.
At this point, she told him she had had enough of this routine. He snapped.
He pushed me to the bed. He started beating me everywhere anyhow.
She ran right to what would bring her to hospital.
He boxed me the eye. As I was running, I fallen down. When I fell down, I heard the maid saying that they are bringing hot water from the flask. Please run away, they are going to pour hot water on you.
She was too weak to get up, and the contents of a flask got splashed on her.
I realized that the moment I ran away, this man might pour this water on my kids.
With her 3-year-old and 7-month child watching, Anita Babirie blacked out. Her collapse was inevitable, according to Dr. Robert Sentongo, a senior consultant in plastic surgery at Mulago Hospital.
A burn injury is one of the most devastating injuries that man can suffer, because oftentimes it burns the defense mechanism of the body, that is the skin.
Before Babirie lost all consciousness, she ordered the maid to apply cooking oil all over her body before getting to hospital. A grave mistake, according to Dr. Robert.
And you pour as much water as it takes to cool the body. It is not cooking oil, it is not sugar, it is not rabbit hair, it is not gunia.
Other do's include removing the clothing, or in cases of fire, it's advised for one to roll on the ground or be wrapped in a blanket. Babirie's burns are the kind that carry high risk.
All burns that are significant, that are life-threatening, that involve the joints, that involve the face, that involve the hand, that involves the private parts, must report to hospital.
Now, most people who get burnt are brought here at Mulago Hospital in Ward 2C. In 2012, over 2,000 people were admitted, and these were the most critical.
Burn from fuel, like the one we had recently, has a problem in that by the time you know that you are on fire, the whole body has been engulfed in the fire. So the chances of sparing a few parts of the body are small. That's number one. Number two, we have fumes coming out of the burning and also out of the fuel. And as you breathe, you try to breathe with the scare of the burn, you inhale those fumes. And those fumes spoil the lungs.
Aside from fire, there are other causes of burns, with what happened to Babirie taking first place in Uganda, mostly burning children under 5.
At what percentage should I even know that someone is really?
Internationally, anything above 10% of the body surface is serious enough. Any burn from electricity must report hospital. Any burn in a closed environment, that the house burnt while people are inside, whether the skin is involved or not, must go to hospital.
Currently, even though he doesn't disclose what is spent on this unit, he says what's available is never enough, considering the fact that most come with grave injuries.
It involves a lot of equipment, it involves a lot of sophisticated medicines. After that, then we start manning the wound. 10% of the body surface is like chest and belly. And that is a massive wound. And in addition to the massive wound that you have, the chances of getting infection are high. So when the infection comes, you again have massive infection. But even before that, the body's fluid mechanism is disorganized by the severe burn. So you lose fluids. You become dehydrated because of the burn. Not because you've been burnt, but because the body can't control, and you go into shock. The commonest cause of death in the first 2 to 3 days is because the kidneys have failed to work. That's why we rush, we put up IV lines, we put in a lot of fluids, massive volumes of fluids. Somebody who has been knocked down by a car will need about 3 liters. A person who has been burnt 20% will need 1 full jerrycan of fluids.
WHO takes burns to be a global public health concern, accounting for about 200,000 deaths per year, with the non-fatal being the leading cause of illness, as described by Dr. Robert. In India, 1 million people get moderately or severely burnt each year. The costs are exorbitant. Countries like South Africa spend $26 million US, about 67 billion Uganda shillings annually on kerosene cookstove incidents. The costs extend to patients who can no longer work to earn a living and instead end up spending more. Some of the risk factors of burns are occupations that increase fire exposure, like what happened this June to Waswangobi, a resident of Iganga.
Natandika okusala nga ndi gas cutter nensala muka LPG butera kuva Kenya kubeera mu chemical ebeera y'amaanyi nnyo teyagala muliro kakati we yayaka yakuba omuliro yakubanga bomu nenetoolola zenna.
He says only God saved him from massive body burns when he finally ran out of the building to the ground.
Omuliro gwo ofa owulira kuba obulumi bw'obeeramu n'obulumi bw'embaddemu bubadde bungi.
Indeed, the pain doesn't go away for some time. The yearning for refrigeration stayed with him for weeks. Like Babilie, short-term treatment is not a guarantee.
They usually heal in 100 days' time.
Other burn risk factors, according to WHO, are poverty, overcrowding and lack of safety measures, placement of young girls in charge of cooking with children to care for, alcohol abuse and smoking, underlying medical conditions like epilepsy, easy access to chemicals like acid, kerosene usage, and inadequate safety measures for liquefied petroleum gas and electricity. The people most at risk are women because of engaging in open fire cooking, using unsafe cook stoves which can light up their clothing, and violence, like was the case with Babilie. Children are also vulnerable. In fact, burns are the 11th leading cause of death of children aged 1 to 9 years and the 5th most common cause of non-fatal childhood injuries, with some as a result of maltreatment. With regard to fire, the doctor fears that, at a national level, more people could suffer serious burn injuries in future.
We're exploring oil, and oil doesn't burn single roads, it will burn full villages. So as a country, we need to be prepared to care for villages that have been burnt.
Prevention is the best way out because burns cause a person to lose out on their life because of ill health, with long-time hospitalization, disfigurement and disability, often resulting into stigma and rejection. Florence, NTV.